A major breakthrough. Researchers at the AIIMS Delhi have developed a simple blood test that could transform how doctors monitor cervical cancer treatment. Dr. Mayank Singh, an associate professor at AIIMS Medical Oncology Lab, highlighted that their liquid biopsy research using a simple 5 ml blood sample to detect HPV-linked circulating tumor DNA shows a clear correlation between DNA levels and tumor size. Now, this breakthrough could predict early cancer relapse and help tailor more effective treatments for cervical cancer patients. Cervical cancer, often caused by persistent infection with high-risk HPV, remains a major health threat, especially in India. Alarmingly, over 55% of patients are diagnosed at advanced stages, where survival chances drop sharply. The overall survival rate in India is just 46%, making early and accurate monitoring critical. The new test detects traces of HPV-linked circulating tumor DNA, and the AIIMS study found a clear link between the amount of the DNA and the stage of the tumor. This non-invasive liquid biopsy could not only indicate how well treatment is working, but also predict relapse early, long before symptoms appear.
We take 5 ml of blood from a patient and try to see that if the treatment is working or not. And how do we do that? So we do that by looking for the signatures that are being secreted by the tumor in the bloodstream. These patients can be referred to the other methodologies like CT scan and other way to look for the detailed follow-up. And so a simple blood test by doing this can actually measure what is happening to the patient, whether treatment has worked or not, and whether relapse is happening in this patient or not. This is what we are trying to do at AIIMS, trying to bring these emerging technologies and apply it to the patient. In the case of cervical cancer, we do a reliable marker, and our work has clearly shown that the HPV cell-free DNA can be one of the markers which can predict the recurrence of cancer in the stomach. Though the patient sample is small in this study, so what we are trying to do is that we are trying to improve upon the patient sample size, as well as adding additional mutation marker to this existing panel.
And with that, it's a wrap on this edition of the broadcast. Lots more lined up. Stay tuned and keep watching Mirror Now.